Well, good morning, everybody. 5 years ago, almost to the day, I was invited to a very big job interview. It was to lead Queensland's biggest investment in prevention, Health and Wellbeing Queensland. I had worked at the Royal Children's for about 20 years and I was happy. I approached a friend of mine and asked, should I take this role? Should I go for this role? What he said to me was brilliant. If you actually want to change the health of Queenslanders, this is where you do it. I want to share with you my vision, which still holds true today. Of course, in preparation, I overthought everything and wrote 33 pages of notes, which I still have, and this is what they said. I wanted to be the blip in the graph, the point in time where obesity rates actually reduced. For the first time in the state and for the first time in the country, I said I wanted to do it together, with communities leading their own work. I pledged I would be relentless to get it done. I reassured the panel that I love nothing more than being around people listening and talking. You all know that's true. And that I wouldn't stop until we got there. I wanted all of the work to be focused on a healthy Queensland, a healthy system, not a sick one. And this was my vision. It's still in my 33 pages. Imagine a place where communities lead their own healthcare journey, where they work together, driving better wellbeing for the next generation of Queensland kids, where they push back against their built environment, where they build a better one, taking advantage of trees and green spaces and shade, by building walking tracks and footpaths, where the retailers and the gyms, the supermarkets, the pharmacies, the radio stations, clinicians, teachers, schools, and the farmers got involved together, where the mayor and the councillors brought all of their community together and to listen to what was needed, where a renewed focus on food emerged. Farming, agriculture, cropping, growing, planting, and eating fresh fruit and veggies. Where kids had access to all of it equally and families were involved throughout the community. People were healthier, children were happier. Obesity rates stopped climbing and they started to actually go down. For the first time in Queensland, in Australia, and maybe even globally. When I got the job, the first call I ever received was from the Mayor of Bundaberg. He told me he was sick and tired. His beautiful town had been labelled the fattest town in the country again. For decades, the media was relentless. The sugar industry are eating the profits and huge serves in fat capital were just a few of the headlines. Can you imagine reading that if you lived there? The Mayor asked me to travel to Bundaberg to see what we could do. It was our first real investment and our first community trip as a team, and we drove the 5 hours in the car because we all wanted to go. In March 2020, we met a group of incredibly passionate, motivated, and prepared people. This community was really ready. In fact, I met a teacher who had decided to give up his plans to go fishing on his day off to be at the forum. He told me this was just too important to miss. Our friends from Sport and Rec, doctors from Queensland Health, teachers, police, fruit and veggie growers, farmers and locals spoke about their commitment to their region. They were inspirational. So we supported them by wrapping research, data, governance and behaviour science around this beautiful place. They did the rest. A very big thank you to Dr. John Pickering, who provided the science and the support that he still provides today. And a very big thank you to the former Mayor of Bundaberg, Jack Dempsey, who made the phone call to me to tell me he was fed up. Because of this community and these efforts, Do Your Thing Bundaberg was created. And 5 years on, 26,598 people have engaged from this one community across 1,426 activities and events, resulting in a record 88% participation rate and 86% program satisfaction rate. with more than half of those reporting their health was actually already better as a result. 75 schools in the North Coast region are now participating in Pick of the Crop, and we are reaching 14,500 students in this region alone. Wide Bay Hospital has also worked incredibly hard to implement a better choice for healthcare for their hospital. And they have improved from 5% of outlets meeting the targets in 2022 to 100% just 1 year later in 2023. I've never said this before, but BMI rates for this region appear to have stabilised at 69%, while state and national rates are trending upwards. Bundaberg, you are no longer the fattest town in Australia, nor will you ever be called that again. In some ways, you're nation leading. Thank you for letting us be just a very small part of what you have already started. Bundaberg is just one example of one place of this beautiful state where we have worked and collected the data so we can show it. Please refer to the GenQ Impact Report to see all of the data that we had collected in the first 5 years. Copies are on the table just outside the main doors at your morning tea break. And now I ask you, do you think the next generation of this town will ever be called anything again? This is what they sent to us.
All the colours of the rainbow are gonna help us kids grow. All the colours of the rainbow to always do our your best. If it's coming from the ground, say yes.
Fruit and veg, nuts and seeds, from the earth, it's all we need.
How long can you live on chocolate cake?
There's only so much that the belly can take.
All the colours of the rainbow are gonna help us kids grow. All the colours of the rainbow to always do our your best. If it's coming from the ground, say yes.
So fresh, sour and sweet, juicy, crunchy, all you can eat.
Keep it healthy, keep it real. It's all about how we feel.
Stronger, faster, harder, happy.
All the colours of the rainbow are gonna help us kids grow. All the colours of the rainbow to always do our your best. If it's coming from the ground, say yes. All the colours of the rainbow. All the colours of the rainbow.
So I stand here today confident that I'm leading one of the best investments in health in Queensland. Our mission is nothing short of extraordinary. We are here to ensure children born today experience better health outcomes than the generations of Queenslanders before them. I'd like to thank Premier Stephen Miles for supporting us throughout our first 5 years, through his time as the Health Minister, Deputy Premier and the Premier of Queensland. I would also like to thank our Health Minister, Shannon Fentiman, for all of her support. And I would like to acknowledge the Health and Wellbeing Queensland Board, and specifically our Board Chair, Steve Ryan, whose leadership continues to guide us through our mission. And the Director General of Queensland Health, who absolutely wanted to be here today. He has been as relentless as we have. Thank you to the Department of Health as well for being terrific partners and bringing this symposium with us to you. I would like to welcome the delegates of the International Network of Health Promotion Foundations. It is an absolute honour to host you here today, and to Dr. Karen Hacker from the Centres of Disease Control within the United States. Welcome to my beautiful hometown. We stand at a pivotal moment in Queensland's history. In just 8 years, we will host the 2032 Brisbane Olympic and Paralympic Games. This global event presents us with an unprecedented opportunity to create a lasting health legacy for our state. Nobody ever in history has been able to present a sustainable health legacy from any such games. Taking what we have done, working alongside the beautiful Bundaberg region, all of our hundreds of partners and the work, the incredible high-quality, evidence-based, systems approach, community-led work produced by the best workforce I have seen, I propose we can support every single community, no matter who they are or where they live, to make a change, one towards better health for the next generation of our kids. We call this Generation Queensland, Gen Q, and we are so proud to drive a bold and focused agenda. Our research shows that children born today are predicted to have a shorter life expectancy than that of our parents. That is due to the impact of overweight and obesity, and we announced that first in 2022. We know that 1 in 2 of us live with a chronic disease, and that could become 4 or 5 chronic diseases by 2035. We know that in Australia, chronic disease causes 9 out of every 10 preventable deaths. We have launched Gather and Grow, the Queensland Government's strategy to improve food security in First Nations communities. We also launched Making Healthy Happen, Queensland's response to the National Obesity Strategy, the first state response in the country. We have built our clinical prevention agenda across healthcare, and we have built a world-class equity framework. Collectively, we are holding 24 government departments, 3 levels of government and private industry responsible and to account to these strategies with us to shift the dial to build health. This is world-leading across government, industry and sectors. In fact, the United Nations contacted us to consider us being a part of their top 50 to drive sustainable development goals, the top 50 in the world. Our Pick of the Crop program is transforming lives in over 200 schools with a combined 45,000 kids, helping kids discover the joy of fresh fruit and veggies. For families, our free Pod Squad app, you can download now, is proving to be a game changer, helping families to eat, sleep and move better. Since its launch in July 2023, it's been downloaded more than 16,000 times. Every hospital, every single one across the state right now provides a better choice in their stores and their vending. Almost 120,000 Queenslanders have engaged in one of our funded events or programs. Bundaberg Do Your Thing may just be the first social experiment worldwide who are halting obesity rates due to their commitment to community health and wellbeing. Gen Q was our vision early on. 5 years later, I couldn't be happier. Gen Q 2032 is our vision for the future. In 8 years' time, I want nothing less than to showcase the sustainable health legacy that Queensland will deliver for its people, a legacy that we can pass on to the next Games host and the next. If any place in the world can do this, it's Queensland. Health legacy for the 2032 Games started in Queensland when the Health Select Committee and both sides of Parliament supported the establishment of Health and Wellbeing Queensland in 2019. Gen Q 2032 will be their legacy and ours. Thank you.